Hello, and thank you for tuning into Answers from the Lab, where we share Mayo Clinic knowledge and advancements on the state of testing and science from laboratory leaders and the people who are making it happen behind the scenes. I'm Dr. Bobbi Pritt, chair of the Division of Clinical Microbiology at Mayo Clinic in Rochester, Minnesota. With me today are Carrie Lahner and April Studinski Jones, who are certified genetic counselors in the Department of Laboratory Medicine and Pathology at Mayo Clinic. Since 2004, the U.S. Surgeon General has designated Thanksgiving as National Family History Day. This is a time to celebrate with family, but it also creates an opportunity for discussing health issues that affect family members. So I am very excited to welcome them to the podcast to discuss how we can use family medical history to inform genetic testing strategies and to explore what genetic data can reveal about an individual's health. So, Carrie and April, welcome.
Thank you. Excited to
Thanks,
be
Dr.
here.
Pritt.
So, April, can you start by reminding our listeners of the main purposes of genetic testing?
Absolutely. So genetic testing can be performed throughout the life cycle and does serve several important purposes. And that all is really dependent on the individual health needs and the reason for testing. So generally, these tests can be broken down into about 7 main types, which Carrie and I can briefly detail. So first,
Perfect.
we have diagnostic testing, which is one of the most common reasons for genetic testing. This is performed on people who are already showing symptoms, and the purpose is to confirm or rule out a particular condition. So for instance, if a child has developmental delays, genetic testing can help identify underlying genetic causes, such as chromosomal abnormalities or single gene disorders. A definitive diagnosis can help guide targeted care, appropriate interventions, and even family planning. Similarly, if a patient presents with symptoms of breast cancer, testing for genetic variants associated with cancer risk can shape their treatment options and provide valuable information to family members.
Predictive or pre-symptomatic genetic testing is for individuals who have a family history of a genetic condition, but they don't have any current symptoms. And this really allows them to take a more proactive approach to understanding their future risk of developing adult onset conditions like a hereditary cancer, neurological disorder, something like Huntington disease or familial ALS. And then another category that we think of with regard to genetic testing is carrier testing. This one is typically used by people who are planning a family or who are already pregnant. This can actually help us to understand whether or not that individual is a carrier of a specific genetic disorder, which will inform family planning decisions. It's particularly useful for people with a known family history of a certain condition, or from populations with higher carrier frequency for conditions like Tay-Sachs disease or cystic fibrosis. Those results might then help expecting parents decide whether or not prenatal testing might be appropriate. Prenatal testing is an opportunity to detect genetic abnormalities in a developing fetus and is often recommended when family history or routine screenings show increased risk. These results help parents make informed decisions about their pregnancy and future care.
We also have newborn screening, which is routinely performed on all infants in the United States. This type of testing screens babies for rare genetic or metabolic disorders that benefit from early treatment. By identifying these conditions at birth, early intervention can prevent issues like intellectual disability, serious illness, and actually even death. We also have pharmacogenomic testing as being another common reason for genetic testing. And this particular testing helps guide medication choices by identifying genetic factors that impact how a person metabolizes certain medications and drugs. Pharmacogenomic testing can help doctors select the most effective medication and dosing and predict treatment responses. This is particularly helpful for managing conditions like psychiatric disorders and cancer.
The last type of genetic testing we wanted to talk about throughout the life cycle was really the opportunity for postmortem genetic testing. So this is conducted actually after an individual has passed away and can help us to investigate possible causes of unexplained death. This type of testing can offer closure to grieving families by identifying those underlying causes. And furthermore, it can help to facilitate some of the testing for at risk family members, which would then enable appropriate surveillance or treatment options for them. So I think, as you can see here, as we've outlined, genetic testing really has a lot of diverse and critical applications that allows us to make care more tailored and effective at every stage of life.
Yeah, thank you, April and Carrie. I love how this goes throughout the whole life cycle of an individual. In laboratory medicine, we're with patients throughout their entire life, and this is a perfect example of that. Now, we've talked a lot about the different times that genetic testing might be useful. Carrie, can you share how physicians or other providers know when and what genetic testing to order for a patient?
Absolutely. This is a great question. There are a lot of really useful resources and approaches that providers could rely on to help make that decision about most appropriate testing. But one of those key starting points might be clinical guidelines from some of the organizations like the American College of Medical Genetics or the National Comprehensive Cancer Network, like NCCN. They offer guidelines or professional society recommendations, which really outline scenarios where genetic testing will likely be beneficial, such as in the case of hereditary cancer or various genetic causes of developmental delay. And they provide that level of guidance on which tests to consider in those specific scenarios. But even before considering a genetic test, providers can start with one of the most valuable tools available in their office, just taking a comprehensive family history. Collecting this detailed family history really can reveal important patterns like inherited conditions or instances of early onset disease, which may signal that increased risk for a genetic contribution to disease. So, you'll often see in the office that providers will use questionnaires or electronic tools to help look for red flags in a family history, which could suggest a need for genetic testing. But then by integrating that family history, any of the patient's current clinical symptoms, medical history, providers can then decide whether or not genetic testing is the best next step. If the case is complex, they might consult with a genetic counselor or a clinical geneticist who can further assess the patient's background and help determine the most appropriate testing strategy or interpret testing results. So I think it really boils down to the combination of guidelines, taking that family history, and a collaboration with your genetic specialists so that providers can feel the most confident in knowing when and what genetic test to order.
Thank you, Carrie. So, April, what would the key information be that would be important for doctors to include in a genetic family history?
Yes, for doctors that are gathering a genetic family history, they really want to focus on key details across at least 3 generations. So looking at grandparents, parents, siblings of the patient, children, aunts and uncles is really essential. In some cases, even expanding that out further to include cousins or more distant relatives can provide really valuable context, particularly if a condition is suspected to be hereditary. Some of that key information to collect includes family members' ages or the year of their birth, any significant medical conditions such as cancer, heart disease, the age of onset for all of those particular conditions can be really important as well. It's important to note instances of rare diseases, inherited conditions, developmental delays, or intellectual disabilities. Congenital anomalies are also crucial for identifying genetic risks. And then even thinking about things like a history of pregnancy loss or infertility can really be relevant, as these sometimes indicate genetic issues as well. Doctors should also document any environmental or occupational exposures and then inquire about previous surgeries or treatments. And then for deceased family members, it's important to acknowledge the age at death and the cause of death. which can be useful for identifying possible hereditary patterns. Thinking about gathering this level of detail can sometimes feel intrusive to patients. So it's important to explain that the purpose is to identify any patterns or clusters of disease that might indicate a hereditary risk. And having all of this information really helps create a more complete picture of their personal health. It can guide both risk assessment and testing options, and ultimately enables more personalized care for the patient and their extended family.
Yeah, well, thank you, April. I think it's really clear that reviewing a patient's family history is this valuable tool for physicians and their patients and may suggest genetic testing for certain patients. Carrie, what type of red flags or other clues might be present in a family history that would suggest a patient may benefit from genetic testing?
These patterns that we've already kind of touched on, something like an early diagnosis of a common disease, whether it be heart disease, cancer, etc., when it's diagnosed at a younger than average or typical age, that's really one of the key red flags that providers should look for in a family history. Those early diagnoses of cancer, heart disease, dementia can always suggest a genetic predisposition or an inherited risk factor. Also, if we were to see clusters of the same type of condition occurring within a family, such as multiple relatives on one side developing an early onset cancer, or if one individual has multiple primary cancers or bilateral disease in paired organs, it may suggest that they have an inherited predisposition. And other significant indicators could include rare genetic conditions, such as certain muscular dystrophies or inherited neurological disorders, as well as a family history of multiple congenital anomalies, intellectual disability, or recurrent pregnancy loss. In families where close relatives have married, what folks in genetics refer to as consanguinity, there's a higher chance of recessive genetic conditions. And certain populations are also more susceptible to specific genetic disorders. For example, Tay-Sachs is more common among individuals of Ashkenazi Jewish descent, and sickle cell anemia has a higher prevalence among individuals of African descent. Unexplained or sudden deaths, particularly at a young age, can also suggest a genetic risk, often tied to conditions like heart rhythm disorders. Of course, if there's a known genetic variant in the family, a more targeted risk assessment can be performed to evaluate whether or not other relatives might carry the same variant. For instance, if a BRCA1 variant associated with hereditary breast and ovarian cancer syndrome is identified in a family member, knowing which relatives have undergone BRCA testing and their results can help clarify the risk for others and also guide who might benefit from testing. Family history is really the evidence-based foundation for decision-making and a framework for more personalized care and preventive options.
Thank you, Carrie. April, as genetic counselors working in the laboratory setting, how do you collaborate with physicians and laboratorians?
That's another great question, Dr. Pritt. Collaboration with physicians and laboratorians is central to our role as genetic counselors in a clinical lab setting. Our team here at Mayo includes about 50 genetic counselors and variant scientists who act as a bridge between the lab and the clinical team that's providing care for the patient. We're really working to ensure that the genetic testing results can be most effectively used in that patient's care. So first, we often consult with physicians who are considering genetic testing for their patient. They can reach out to discuss which test might be most appropriate based on a particular clinical situation. And we also assist in assessing factors like test sensitivity, specificity, and whether a particular gene panel or other test would be most informative. We then help explain what the different tests can reveal, as well as any limitations, so that the physicians can make the best possible decisions for the care of their patient. We also aim to be responsible stewards of healthcare resources. When specimens arrive in the lab, our team is involved in test utilization management, where we review test orders along with the clinical and family history that's provided by that clinical care team. What we've seen is that in about 12% of cases, we find that an adjustment needs to be made to the test order to ensure that it really matches the patient's needs and they're getting the best test for them. So for example, if a patient has several tests ordered, we might suggest switching to a more comprehensive panel. On the other hand, if the family history that's provided with that sample indicates that there's a known familial gene variant, we may then recommend testing for only that specific variant. As lab genetic counselors, we really strive to make sure that each patient gets the right test at the right time. On the laboratory side, we work closely with our colleagues to interpret and validate test results. This collaboration involves reviewing the data and assessing the significance of any variants that are detected within the context of that clinical information that was provided at the beginning. So if a result is complex or ambiguous, we may actually initiate a follow-up discussion with the provider to clarify what the results mean and explore whether further testing is needed for either that patient or sometimes another family member. Our main goal really is to streamline communication, provide that laboratory stewardship oversight, interpret the results within the clinical context, and ensure ultimately that patients receive clear, accurate information to guide their care.
Well, thank you for all of that. This has been incredibly helpful. We'll end with one question now looking forward. Carrie, I'll ask this of you. The field of genetic testing has been evolving rapidly. Can you talk about some of the recent advancements in the field that's helping to improve diagnostics?
Yeah, absolutely. Advancing technologies in genetic diagnostics have greatly enhanced our ability to diagnose, treat, and even prevent certain disease. Just over the tenure of my career, it's certainly been amazing to watch this field evolve, and it's even more exciting, frankly, to be a part of it. For instance, whole genome sequencing now allows us to identify disease-causing variants in regions of the DNA, which we once considered junk, quite literally. We called it junk DNA, and now we know how important it is. And not long ago, genetic testing techniques like haplotype analysis and southern blots were the norm, where now they seem like an ancient art, frankly. In the 1990s, we began performing single gene sequencing, and in the last 10 to 15 years, we've made a ton of progress as we've seen the rise of next generation sequencing, which allows us to revolutionize genetic testing by enabling us to read multiple genes simultaneously on a massively parallel platform. And this makes all of our testing faster and more comprehensive. Looking ahead, emerging technologies like nanopore sequencing can even further improve the precision and speed with minimal equipment. These advancements are critical because understanding the mechanism behind any genetic condition is our gateway to effective treatment and potentially prevention. Just like you need to pinpoint the source of a noise in your car before you fix it, realizing the potential of personalized medicine starts with the understanding of the genetic basis of disease. And once we have that, targeted therapies can be developed to identify and address the specific cause. Despite these advances, we know genetic testing is still underutilized, and much of this is due to the uncertainty around when a patient qualifies for testing, just what we've talked about here. So this is where that family health history really plays that crucial role. It's the most cost-effective and accessible tool we have for guiding our genetic testing decisions. And we know that with that clear diagnosis, patients gain options to better personalize their treatment and healthcare.
Well, thank you, Carrie. Yes, it all starts with that good history and patient contact, doesn't it? Well, April and Carrie, it's been such a pleasure having you on. I've learned a lot, and I'm wishing you both a very happy National Family History Day, as well as to all of our listeners and viewers. Thank you again for joining us today.
Thank you.
Thank you so much for tuning in to Answers from the Lab. Be sure to subscribe to this podcast and don't forget to tune in every Thursday and every other Tuesday.